I'm Dr. Alex Krotulski. I serve as a research scientist at the Center for Forensic Science Research and Education, and I'm also the program manager of our NPS Discovery program. The majority of the work that I do focuses on the area of forensic toxicology, but I also serve as a forensic chemist looking at seized drug materials for these new synthetic drugs as well. The synthetic opioid class of the novel psychoactive substances has changed a lot over the last year. What this class looked like just 12 months ago is not what it looks like anymore today. So typically, novel synthetic opioids have gone the route of looking structurally similar to fentanyl. So fentanyl emerged in the illicit drug market or the illicit opioid market around 2008 here in the United States. After that, several different derivatives of fentanyl, what we commonly call fentanyl analogs, emerged on the opioid market, causing deaths in a number of states around the country, often centralized around the Midwest. However, the Drug Enforcement Administration enacted core structure scheduling of fentanyl-related substances, and this has largely resulted in these substances going away and new synthetic opioids emerging. These new synthetic opioids we see today are very structurally different from fentanyl. Typically, they don't look like fentanyl, and they certainly don't sound like opioids by some of the names that we call them. At the end of last year and the beginning of this year, the most prevalent NPS opioid was nitazenes. We first identified that substance in our laboratory late last year in 2019. Then up through mid-2020 this year, we had identified that substance in more than 250 death investigations. Again, typically these death investigations are centralized around the Midwest, but by the end of its life cycle, isotretinoin was seen in many states across the United States. Right now, the most prevalent synthetic opioid is morphine. This substance, again, first emerged in the Midwest. We are starting to see some outward trends at the moment. It's typically found in combination with things like fentanyl and flualprazolam, and NPS benzodiazepine, which may lead to why this substance is being found in death investigation based on this potentiation of opioid and benzodiazepine effects. So as we know it, we need to make sure we are aware of these new substances in this class, looking for new substances, as these are certainly a threat to public health.